Hi, today we will be exploring euthanasia. This is a topic that I research a different aspect of once per semester of school. For instance, last semester in philosophy class, I researched the ethics of euthanasia using the course textbook titled Contemporary Moral Arguments, Readings and Ethical Issues by Louis Vaughan. In doing so, I learned that euthanasia is a multifaceted topic. Vaughan defines euthanasia as directly or indirectly bringing about the death of another person for that person's sake, and this is also known as mercy killing. So, euthanasia has five main categories: passive, active, voluntary, non voluntary, and involuntary euthanasia. Passive euthanasia is where you would allow someone to die by not making an attempt in prolonging their life. So, for instance, in a hospital, if a patient's heart stops, the medical professionals have a moral and legal duty to do something in order to prolong that patient's life. So, there's like a series of steps they would have to follow. Often this would include cardiopulmonary resuscitation, which is also known as CPR. Now, if we applied passive euthanasia to this scenario, and we say that the patient's heart stopped, and in the scenario we're all medical professionals, we would say that we all stood there and we did nothing to get the patient's heart going again because we decided that we're just not going to take any measures to prolong this patient's life. Now, at this time, consent of the patient allowing us to do this isn't necessary. It will be in a little bit, but right now we're just defining what passive euthanasia looks like. So, active euthanasia is a counterpart of passive euthanasia, and this is where I'm going to go to next. Active euthanasia is where you directly cause someone's death, and it's a mercy killing. Like, it absolutely has to be a mercy killing, otherwise, it's just senseless murder. And that's kind of the distinction of active euthanasia right there. So, for this example, I'll give you an elderly cancer patient who is suffering greatly. They're suffering from an insurmountable amount of pain due to the cancer, and we decide that we're going to inject this patient with a bunch of morphine, enough to cause a fatal overdose. We inject this into the patient, and they die. Consent, once again, is not going to matter at this point of time because we're just looking at what active euthanasia looks like. So, okay, we're going to go into voluntary euthanasia with that being said. This is where a competent patient, that's someone who's in their right mind, consents to being killed and even tells you how they want it done while they're competent enough to do so. So they may even say something like, do it once I'm no longer in my right mind, or do it now because I'm just suffering too much. So for this example, I'll bring us back to our first scenario. We're back in the hospital, okay, and we are going to be the medical professionals in this scenario, and our patient's heart stops. So we know that they're going to die without any intervention. We also know, and this is where I'm going to add on to the scenario, that 6 months ago they said, let me die, and they signed an A&D order, which is an allow natural death order. They also had signed a DNR, which is a do not resuscitate order, should something happen, like they stopped, their heart stopped or they stopped breathing. So we know they have this, and as the competent and trained medical staff in this scenario that we are, we decide that we're going to do nothing. We're going to allow them to die, and we're not going to make any attempt at resuscitating them or prolonging their life in any way, as that would go against their wishes. This can be further compounded as voluntary passive euthanasia, because not only do we have consent from the patient in their death, but we also didn't cause their death. We didn't cause their heart to stop. It just stopped. And we allowed that to take its natural course. And by that I mean we just didn't do anything to prolong their life. Now, if we exchange this scenario for the second scenario where we lethally injected an elderly cancer patient with morphine, and we say that in this scenario we're doctors that live in a state where assisted suicide is illegal, and we had the patient go through the legal process of being eligible for assisted suicide, and to kill them in this manner, this would be voluntary active euthanasia, because we have consent from the patient saying, yes, please inject me, I'm suffering a lot and I just really want to die, and we also directly cause their death with the lethal injection. Alright, here's where consent starts to hit a gray area in, well, ethics. Law too, but mostly ethics. I mean, all of this was kind of a gray area in law, but ethics especially with this one. Okay, So without any further ado, non-voluntary euthanasia. This is euthanasia that is performed when the patient is not competent enough to say that they want to be killed and did not previously disclose their preferences. And this kind of goes in hand with involuntary euthanasia, but as you'll see later, there's a slight difference between the two. An example of non-voluntary euthanasia would be if we were all sitting in a hospital, and in this scenario, we're competent medical staff, and we are sent a patient with severe dementia. I'm talking like they don't remember their own name. They, are constantly asking things like, where are we going? What are we doing now? You give them instructions like, Miss Jane Doe, please hold that handrail. And she looks at you like, okay, and then maybe forgot what a handrail is, or forgot where it's at, or forgot that you said anything just now, and you're just kind of a completely new person in front of them all of a sudden. Like, that's how bad I'm talking in this scenario, just to give a bit of a picture. And when we give them these like instructions and everything, so we give them something that says, hey, would you like to die, right? Here's how you can be eligible for euthanasia. They're not going to know what we're talking about. So the other thing that I'm going to add to the scenario is, let's say this person has cancer, because I mean, dementia, it sucks, but there's plenty of people that live decent lives with dementia. Let's say they also have cancer, and they're so confused that they don't understand cancer treatments. We give them instructions for their chemo, and they forget them, and we need like a team of nurses just to keep them calm for the whole thing. Now let's say they had a power of attorney, and this power of attorney said, hey, you know what, we're going to stop doing this. They keep freaking out. I'm not really comfortable giving them this chemotherapy. They're not doing okay. How about I put them on hospice and we just let them die naturally? And we, being the medical staff, are like, oh yeah, it's totally valid. She's an elderly woman. You can do that. She's sick. Her cancer is likely terminal, and she's got dementia. So we're okay with this. And they sign off, and now we're going to let this lady go through hospice and die. Now let's say towards the end, she just hit an insurmountable amount of pain from the cancer. And we're giving her painkillers, we're giving her morphine, we're giving her everything we can, but it's just not helping. She's in pain and she's dying. So what if we said that we're going to actually quicken her death with, maybe a lethal injection? And we'll pretend in this state we have the power to do that with the power of attorney. The power of attorney can sign all the documents, and we can go ahead and do that. And we do that, and she dies. Well, here's the difference between doing something to cause the death versus not doing something to cause the death. And giving her hospice care and just letting her die, however painful, that's passive non-voluntary, because she didn't volunteer her right to go on the hospice and be allowed to die. However, if we inject her with something like morphine and we give her a fatal amount and she dies, that's a form of active non-voluntary euthanasia. None of this is necessarily wrong per se, but it's not like we have legality over this, and it's not like this is a one case fits all type of scenario. So with that said, we're moving on to involuntary euthanasia. And this is where euthanasia is performed against someone's will without getting consent while they are competent. And this is where non-voluntary and involuntary euthanasia sort of cross over, because both of them are without consent. You either couldn't get it when they were competent, because this tragedy just happened so quickly, or they're just they have never been competent. You don't have a way of ever asking them. And the other thing is, in this scenario with involuntary, my bad, involuntary euthanasia, is you may not even have a power of attorney or any family member you can go to and say, hey, what do you want me to do with your loved one? With that being said, I'm going to move on to our example. We're going to say that we are doctors in a hospital. We have a state that allows for assisted suicide. And we're presented with a patient that has a coma and brain trauma from a serious car accident. And after about a year of having them in this hospital and in this coma, we've decided that they're not going to wake up. And even if we did, we'd have to put them in another coma because their brain trauma is so severe, they won't be able to recover without being in a coma in any form. The other thing we look at, which to be clear, they weren't going to recover anyway. I'm saying they won't be able to recover into a functioning or into a way of functioning while they're awake. So they'll have to be asleep for a while. And that's a big if they can be awake, because they might not be able to be awake. Um, we say that this patient is completely identified. They had no ID, and there's a picture of their approximate appearance all over the news. This is a highly publicized case, is what we're going to decide in this scenario. And we go to, say, a judge, because let's say that in this state there's a clause saying, like, if you can't identify this person and they're in some sort of situation where euthanasia may be a benefit to them, we can go to a judge and say, hey, can you see this case? This is somebody who's unidentified. This is a John Doe. He's going to be in a coma, and it's honestly best if we just pull the plug now, because even if he were to wake up, it's like he's not going to be able to walk. He's so atrophied, we'd have to put him back in a coma anyway. He's not going to get back to a conscious level of functioning, right? Let's say we can do that. And we do, and we bring it to the judge, and the judge says, oh man, that sucks. You're right, doc. Let's just euthanize them. This might be best for them. This might prevent any further suffering. So we say, great. And we walk back in the hospital, pull the plug, and that's it. That one, it's hard to tell if that's active involuntary or passive involuntary euthanasia. Active in that we did pull the plug and we did make it so that they're now going to die, but also passive because, they were going to die anyway, if we didn't put them on life support. So I think in this scenario, it's best to label as active involuntary because, well, if we didn't put them in life support at all and just let them die, that seems to more fit passive than us pulling a plug after taking a measure to prolong their life. Regardless, the point being is that this is where a gray area sort of shows up in the euthanasia debate. Now with that, I will stop this conversation. We'll move on to some other topics before we get to the end of this project. I thank you for listening and hope you have just the best day today.